Hi, I'm Priya Joshi from GE Healthcare Private Limited. I'm the business manager for ultrasound, and our office is based in Begumpet in Hyderabad. What you're seeing behind me is the world's best technology ultrasound system called the Voluson E8 BT10. And why is it unique? 4D was launched years back, so you would be wondering why so. In 2002 was the time when we first launched 4D, and it was just restricted to seeing the fetal face, maybe the baby yawning or smiling, which had very little clinical value. But it was GE Healthcare which realized and invented a lot of unique features like 4D fetal echo, like tomographic ultrasound imaging, which brought in images like CT and MRI. But what do we have new in 2010? Something really revolutionary, and we believe that until any technology can solve a clinical problem, it is not worth an invention. So with that motive, we introduced the Voluson E8 BT10. We know cancer is becoming a very serious problem in India, and looking at women's health care, there are two main areas where cancer is really becoming very, very aggressive. The one is the breast cancer, for which there is huge awareness. The second is also emerging very strongly, which is a cervical cancer. To address both the problems, we have invented the volume technology, and with the volume we have incorporated the latest technology called the elastography. With elastography, we can code the tissues in form of color coding, where the cancerous tissues and the non-cancerous tissues will have different color codes, and it will help the radiologist to diagnose better and with more diagnostic capability. So what for the masses and for the people? Earlier diagnosis at stage 1 cancer, it's still, we can cure it, we can do therapies and treatment and lower the cost. If the same is detected at the second stage, we know the cost goes up, and even the patient's condition is not that very good for treatment. Coming to a very different area, which is the pregnancy scans. We all know India is one of the largest populations in the world, and lot of births happen in India. But do we really give importance to the first trimester scan? For everybody who is hearing me, I would like to request you, more than going for the second trimester scan, please give importance to the stage when the mother is 10 to 12 weeks pregnant. This is the time each of you should go for a nuchal translucency scan, which is also called NT, or first trimester screening. And here again, E8 brings a world-class difference in diagnosis by automated NT calculations, where we could detect very accurately the measurement of NT, and that gives an indirect indication to Down syndrome.